Khloe Kardashian is recovering from a staph infection. Khloe Kardashian is recovering from a staph infection that she's believed to have picked up while in the hospital with her estranged husband, Lamar Odom. Khloe was forced to cancel part of her book tour due to the infection. She tweeted about her health ordeal over the weekend. According to TMZ, Khloe developed a lesion on her leg that became painful. She also has had a high fever and swollen glands and has been sweating profusely. But what is a staph infection exactly? It's a generic term for an infection that occurs with the Staphylococcus bacteria, says board-certified infectious disease specialist Amisha Adala, MD, an assistant professor at the University of Pittsburgh Medical Center. It's a common bacteria that lives on people's skin. While staph can live on your skin and not bother you, you can become infected with staph through a break in your skin, like a cut or sore. It can then create a skin lesion but can also infect your blood and spread throughout the body. It's not fun to have, no matter where the infection is, says Adala. Staph infections are usually treated with antibiotics, but how much and how long it will take to recover varies depending on where the infection is and how serious it is. If it ends up in your heart, for example, we're talking a months-long recovery. If it's just in your skin, it's probably a matter of weeks. However, Adala points out that Khloe's probably doing okay since she's been tweeting a lot lately. It's not uncommon to get a staph infection in the hospital, like Khloe did, and that's often where someone will pick it up. Since there are so many germs floating around on patients and even on equipment, it's pretty easy to catch something, especially if you're in close contact with someone who has the germ, and according to the Centers for Disease Control and Prevention, 1 out of 3 people have it on their skin. People may also get methicillin-resistant Staphylococcus aureus, MRSA, after visiting a hospital, which is a serious, life-threatening staph infection that's resistant to many antibiotics. As for the stress claim, Adala says he isn't aware of a direct link but points out that anxiety can have a negative impact on a person's immune system, making it tough to recover from any illness.